Hello everyone. Joint pain is a common complaint with which children present to pediatricians, and some of these children may be diagnosed to have arthritis. In the coming presentation, I'm going to talk on arthritis in children, a few facts which are must know for every pediatrician. Now, juvenile idiopathic arthritis, one of the most common forms of chronic arthritis in children, and many pediatricians call this juvenile rheumatoid arthritis, which was the old term. We must know that this is a very common disease. 48 in 1 lakh children, as per one of the Indian studies, have juvenile idiopathic arthritis. That would mean several thousand children in India. And we all know that there is a clear lack of pediatric rheumatologists in the country at the moment. So, who will manage these children with arthritis? It has to be a clear collaboration between a pediatrician and a pediatric rheumatologist. Every child with arthritis deserves appropriate care. And in today's world, wherein e-consultation is so easily possible, I would want to set a new roadmap wherein a child is examined by a pediatrician, and through my presentations which you can view on YouTube, the child can be evaluated, and once evaluated you can have a consult with your pediatric rheumatologist, and a child in any corner of this country with arthritis should receive appropriate care. So when a pediatrician is faced with a child with joint pain or arthritis, there are three questions he must ask. One, arthralgia or arthritis. Second question, does this child have acute arthritis or chronic arthritis? And the third question, if there is arthritis, are there systemic features present or absent? Believe me, if you ask these three simple questions, we can all make a diagnosis of juvenile idiopathic arthritis. So what is arthralgia and what is arthritis? Arthralgia is a condition wherein children have joint pain, but there is no swelling, there is no restriction of joint movements. Whereas in arthritis, there is obvious joint swelling, joint movements are restricted, or you may find stiffness or painful movements. So when a child presents to you with joint pain, it is very essential at the beginning to differentiate between arthralgia and arthritis, because a large number of children presenting to outpatient departments may have arthralgia and do not need any further evaluation. And once you examine a child, you must do what is known as the PGALS, the Pediatric Gait Arm Leg Spine Screen, and in one of my follow-up presentations I would show how to do a PGALS, and this simple PGALS screen, which can be done in 2 minutes in OPD practice, can help us find out what is wrong with the joints. The second question, if you feel that this child has got arthritis, there is joint swelling, ask a question, is it acute? That means the duration of illness is less than 6 weeks, or is it chronic? In the setting of acute arthritis, one of the commonest causes for acute arthritis is viral arthritis, the other diseases like Henoch-Schönlein purpura, and do not forget leukemia when a child presents with fever, short duration, and arthritis. However, when you have a child with chronic arthritis, one of the most common causes would be the juvenile idiopathic arthritis. The next question I would want to ask is, are the systemic features present or absent in a child with chronic arthritis? For example, a child presenting with chronic arthritis has fever, malar rash, oral ulcers, is likely systemic lupus erythematosus, whereas a child presenting with arthritis and no systemic features start thinking about juvenile idiopathic arthritis. Let's quickly look into two cases. Case number one, a 12-year-old girl comes with swelling of small joints of the hands, the metacarpophalangeal joints and the proximal interphalangeal joints. So the small joints of the hands are swollen for the past 3 months. There is arthritis. That's number one. And this is clearly a chronic arthritis because it is more than 6 weeks. There is no rash, no systemic symptoms, and this girl is diagnosed to have juvenile idiopathic arthritis. And what is the type of GIA? Since many joints are involved, it's polyarticular GIA. Let's look into the second case. A 12-year-old girl again comes with swelling of the small joints of the hands for the past 3 months, much like the first case, but this time this girl has got a malar rash, a butterfly rash over the face, low-grade fever going on for last 3 to 4 months, oral ulcers, and when we test, the anti-nuclear antibody is positive, and you know the diagnosis here is systemic lupus erythematosus. So by these two cases, I can show you that Looking at systemic features in a child presenting with arthritis is very important before you make a diagnosis of juvenile idiopathic arthritis. So, what are the three questions? Is it arthralgia or arthritis? And if it is arthritis, is it acute or chronic? And if it is chronic arthritis, are systemic features present or absent? Friends, believe me, if we start asking these simple questions in every child who presents to us with joint pain, we can all make diagnosis of juvenile idiopathic arthritis. And in the coming presentations, I would want to deal with these conditions in much detail so as to make sure that every pediatrician in every corner of the country is able to diagnose these conditions and treat it. Thank you.